can save your applause till after you've seen the amazing. Thanks, Li Peng. You can call me Drew because there's another Drew at VisualSonics, and we get each other's emails all the time. So thanks for having me here. It's great to see the system's finally installed, and we're doing training here, and we're seeing some interesting applications come in. In the meantime, I just want to give an overview of the kind of things that we're working on, really a general overview of not just photoacoustics, but also just of ultrasound. And I titled the presentation Tools, Data, and Applications. I've sort of structured it in the following way. I talk about visualization, measurement, and analysis. These are really the tools on the system that can be used. But implicit in talking about these tools are the kind of data that you can get, so from anatomical, functional, and then down to molecular data. And then finally, I've got a bunch of examples, again, some implicit, some explicit, just about different application areas, cardiovascular, cancer, and neuro as well. So hopefully this will kind of stimulate your imagination. If you have an application that you're not currently working on with the system, please by all means talk to Li Peng, and maybe this is something that could be useful for you. I'm just going to start out with a general introduction to micro-ultrasound. What is it? And then some of the tools with micro-ultrasound. And then I'll do the same with photoacoustics. The majority of this presentation is photoacoustics, but by all means you can ask me, or we've got Lindsay Hughes here, who a lot of you probably know already. So we'd be happy to answer questions about anything on the system. So what is ultrasound imaging? Well, we have a transducer. It transmits an ultrasound wave through a coupling medium into the body of the animal. It's reflected back, and then we get an image. My laser pointer's dead, unfortunately, so I'll be gesturing a lot like this. So anyway, we get an image that looks somewhat like this B-mode image here, bright mode image we call it. It's just an ultrasound image where things that are bright are things that reflect the sound strongly, things that are dark are things that transmit the sound. And there are several advantages to using ultrasound for doing your imaging. It's an in vivo modality. It's high resolution. We get the resolution is maintained at depth, and it's real time and non-invasive in vivo. So you can do these longitudinal studies using the same animal as its own control, and so on. And the fact that it's non-invasive is a big advantage as well. Now, the difference between our ultrasound, micro-ultrasound, and clinical ultrasound is the frequency. So clinical ultrasound is typically 3 to 15 megahertz. We're talking about 30 to 80 megahertz with our system. And I like this slide because if you look on the right hand, you can see these two images, and they actually look like they're the same resolution. And then you realize that in the top image, you're looking at a human fetus. In the bottom image, you're looking at a mouse embryo. So you're looking at something, the size of a melon versus the size of a coffee bean, and we can get similar resolution. So the real advantage of that high frequency is this really nice resolution. And I put this image up. There's a bit of a glare, so it looks a bit better on my screen, but we can walk downstairs and look at it on the system itself if you're interested. But if you just take the ultrasound probe, it's a handheld probe, you just put it down on an animal over a structure such as the kidney, what you see here, this is the image you get. So it's simple. You turn it on, you press a button, you put the probe down, and this is the image you get. So we're looking at a kidney here. You can see the cortex, the medulla, renal vein, renal artery, abdominal aorta, and so on. So you really get a good sense of not just the high resolution, the anatomy that you can see, but also the real-time aspect. You can see the motion of the animal breathing, you can see the pulsation of the abdominal aorta, and so on. So I'll talk now briefly, just in the context of the micro-ultrasound, about the visualization, measurement, and analysis, the tools, again, that you can use with the system. As far as visualization goes, I just put this example up. This is a paper that was published in PLOS 1, doing this sort of xenograph model of pancreatic tumors. And I have these optical images here as well, and I took these right from the paper. A few comments about this, about the sort of visualization aspect of the system. We can compare something like this, these optical images, where you can generate these nice signals here, but how can you really quantify these signals? How can you get more quantitative data out of them? Just seeing these signals on the surface of the animal. as soon as we go in vivo into, at depth in the animal, into the pancreas, we can now outline the morphology of these actual tumors because they look different than the surrounding pancreatic tissue. You can tell the morphology, the size, volumes of the tumors, and really tell, these are quite different tumors. As you can see by the 3D renderings here generated from our system, but it would be difficult to tell that just if you're looking at a simple optical system or even palpation. So to be able to visualize these kind of things that are in the animal, especially with orthotopic tumors, is very valuable. A couple of sort of side notes is, being able to do volumes, measure the growth of the tumor and the change in the tumor. And also these tumors were implanted using another visualization technique on our system, which is image-guided injection. So at the top right, you can see there's a pulled glass pipette coming in, going into an externalized embryo. You can inject, drugs, cells, treatments, whatever. It's going into the fourth ventricle of the animal's brain. And then you can reimplant that into the mother and it can grow up. But this image-guided injection technique was used to implant these pancreatic tumor cells into the pancreas of the mouse in a fairly minimally invasive way. That's another tool. Another tool on the system is a power Doppler. So power and color Doppler rely on blood flow. So things that are moving in the body of the animal, mostly the blood, will give you a signal, and then you can measure that signal, measure changes over time. In this example, we're just looking at a tumor, angiogenesis in a tumor. So we're looking at the increase in vascularity over time from day 1 to day 4. And you can just visualize this and see different things that way. Another visualization tool is being able to use an ultrasound contrast agent. So this is a microbubble. It's 2 to 3 microns in size. It's filled with an inert gas. It's a phospholipid shell. You inject this via the tail vein. It goes into the circulation of the animal, stays within the circulation. And when these microbubbles get hit by ultrasound waves, they oscillate, and they give you a very, very strong signal back out. So they give you what's called a nonlinear signal. Because the signal is nonlinear as opposed to regular ultrasound signal, which is just from regular tissue, which is linear, we can sort of separate those out, and we can take out the background tissue signal and in favor of having more of this microbubble signal. And that way you're going to get measures of perfusion. This is what it actually looks like. So again, I'm not sure how well the images are, they're a bit washed out here, but in the sort of background, you'll see the B mode image, the bright mode image in the background. We're always co-registering these images. And then in the foreground, you see this sort of speckly stuff coming into the image. And I'll start over here. It's about to loop back. But this is upon injection of the microbubbles. First, we see basically nothing except maybe the skin line. Upon the injection of the microbubbles, you see a lot of signal coming in here. And you can start to distinguish regions of that tumor which are well perfused versus regions which are not so well perfused. So that's another ability to visualize perfusion within a tumor, within an organ, in real time. With our system, so we can do this in a mouse. So what you're looking at in the top left there is a beating mouse heart. And there's a whole bunch of measurements associated with that, things like cardiac output, ejection fraction, fractional shortening, and so on, that we can do just with a single image like this, just with the single long axis image of the left ventricle. Similarly, we can use Doppler to do blood flow and pulse wave Doppler to actually quantify that flow, to actually learn about peak velocities, E to A ratios, and again, all sorts of different measurements there. M mode can be used, this is looking down one line over time with very high temporal resolution to look at the motion, in this case, the motion of the heart walls, thickness of heart walls, thickness of vessels, and so on. And then tissue motion as well, so looking at this mitral annulus, for example, and seeing the motion of the mitral annulus and relating that to things like diastolic dysfunction as well. So these are, again, I'm putting a lot on one slide, but this is our sort of cardiovascular offering, and frankly, this is our bread and butter because it is used in the clinic. Clinicians and cardiologists are very familiar with these kind of tools. On the analysis side, now I showed you earlier, this is actually that same tumor. It's a pancreatic tumor, an orthotopic pancreatic tumor, by the way. This is the same tumor that I showed you, that injection of microbubbles coming into the tumor. And we have this vivo contrast quantification software which allows you to quantify this signal. So we have a whole bunch of data points for each region in that tumor. This software has these curve fit algorithms. So these algorithms which can fit curves and then give you numbers for things like peak enhancement, time to peak, washing rate. Peak enhancement, for example, has to do with relative blood volume, time to peak, and washing rate have to do with blood flow. So a bunch of different parameters that can be measured. And then, of course, you get these parametric maps. So you can visualize areas of this tumor, for example, which are more perfused versus areas which are less well perfused. And here we're talking about the sort of microenvironment of the tumor, which is, you know, a buzzword in cancer research, but I think it's relevant as well. Different parts, a tumor is not a homogeneous thing. It's a very heterogeneous structure, and this sort of can get right down to that level. Targeted bubbles as well. So that last was just looking at perfusion, but we also make streptavidinated bubbles. So if you have a biotinylated antibody, you just stick that antibody onto the bubble, inject it into the animal, and if you've got cell surface markers in the endothelium, remember the bubbles don't leave the circulation. If you have cell surface markers in the endothelium, like PCAM, BCAM, VEGF, that kind of thing, you can actually do molecular imaging. And in this case, you're looking at relative expression here, relative expression of VEGFR2. So, and again, you can see different parts of that tumor have different relative expression of that marker.
So, Drew, how linear is the response to that? So the intensity on that panel that you have on the right,
yep,
somehow responds to the number of receptors.
Yes.
Do we have, you know, 1 or 2 orders of magnitude in linearity of response, or is it just high, low?
So this measurement is quantitative. The signal is directly related to, you know, the number of bubbles that are there that we can get from it. So this is actually quite quantitative. I don't have the numbers just off the top of my head, and I don't think you can really say, okay, there's X number of receptors. There's a lot of things going on here. You know, how many bubbles can you fit together versus the receptors? So the bubbles are huge relative to the receptor expression. So how many bubbles can you fit within a certain area? But I can certainly look up some references and find that for you. These are, again, more sort of sophisticated analysis packages, VivoStrain and VivoVasc. So this is looking at really spectral tracking algorithms, to put it very simply. But basically ways to monitor the motion of heart and vessel walls and measure things like strain rate, velocity, displacement, these kind of parameters, which can be early indicators of cardiac function, for example. Sometimes strain and strain rate can be really early indicators. Before you see changes in cardiac output and ejection fraction, you may see changes in strain and strain rate. This is just for interest's sake, the image on the left is an infarcted heart. You know, normally hearts have this nice pointy apex. This one is completely ballooned out. That's because there's been an infarct and that muscle has been damaged. And you can look at points along the surface of the myocardium and say, okay, how is this movement? Is it moving normally? What is the strain? What is the strain rate? You can do segmental analysis and a whole bunch of different things. So I can elaborate on that further afterwards if you've got questions. And then VivoVasc, doing the same thing in vasculature. So being able to look at carotid arteries, which are maybe atherosclerotic, they're getting plaques on them, and being able to measure vessel stiffness, and different pathologies can affect vessel stiffness, elasticity, sensibility, and these kinds of things. So these packages, these VivoStrain and VivoVasc packages, allow you to do those kind of measurements. I'm now going to move into the photoacoustics portion of the talk. So what is it, first of all? Photoacoustics is really a hybrid optical ultrasound imaging modality. What does that mean, really? We use a pulsed laser light to illuminate a tissue. Anything in that tissue that absorbs that light gives a thermoelastic expansion, which results in a pressure wave which travels through the tissue. That pressure wave is essentially an ultrasound wave, and we can detect that ultrasound wave with our transducer. So that's the kind of long version. The short version is we're sending light in, there's an absorption of that light, and we get sound out to make an image. And these are the kind of images we can make. So these are just sort of 3D scans, superficial vasculature in a mouse in the axilla, the sort of abdominal region, and the hind limb of a mouse. And the reason it looks like vasculature is the main absorber at the body of an animal is hemoglobin. So at the wavelength range that we're using, 680 to 970 nanometers, which is called the near-infrared range, we're seeing mostly hemoglobin. So we're able to visualize blood. We don't need to rely on flow to see that blood either. We're just looking at the presence or absence of hemoglobin. This is what the system looks like if you haven't seen it yet. And if you haven't seen it, please speak to Li Peng and she can give you a tour down in the MIC facility. But this is the ultrasound system on the right. That's the sort of guts of the system. Right beside that is the laser. So this is, if anyone's been to a laser lab, you go in, the windows are blacked out, you've got a table that's floating on air, optics everywhere, heating or cooling system, power supply, all these things. You've got to wear safety glasses, have a laser safety officer. We've taken all of those things and just put it into this one sort of cabinet. And then we deliver the light via a light tube or a fiber optic, which is integrated into the ultrasound probe itself. And the ultrasound probe, you can, the ultrasound probe you can see right here. So we deliver the light right into the probe and then collect the ultrasound out here. We've got the animal imaging platform, which is heated to maintain the physiology of the animal. It's got leads so we can monitor ECG and respiration rate. There's a 3D motor here, so we can collect 3D volumes by just collecting slices and stacking them together. And then that whole enclosure here is so that you don't need a whole dedicated room to run this system. You can have this system in your room beside, your other equipment, and have your coworkers not having to wear safety goggles and that kind of thing. The key feature of the whole system is the ability to tune the laser, and I'm going to talk about that in quite a bit of detail later. But this allows us to do things like multispectral imaging. So again, visualization, measurement, and analysis. What can we see? What can we measure? What can we sort of analyze on the system? If you just look at an ultrasound signal, it can be somewhat difficult, or sorry, a photoacoustic signal, it can be somewhat difficult to really know what exactly it is you're looking at, where exactly is the signal originating, and that kind of thing. Which is why we always acquire the ultrasound essentially simultaneously with the photoacoustic signal as well. And we do this with other modes as well. The Doppler, we always have the background V-mode ultrasound image because we want to know, for example, that we've got a needle coming into a tube. In the context of the anatomy, what is going on? And I think this is important to be able to see not just in microenvironments of tumors, but in organ systems and different parts of the animal, and know where you are in the animal and where the signal is originating within the animal. As I mentioned, we can do this in 3D and 2D to visualize things like vascular structure, where there's blood pools, and this kind of thing. As far as measurement goes, one nice thing about imaging hemoglobin is hemoglobin absorbs differently depending on whether or not it's carrying oxygen. So deoxygenated hemoglobin, that blue line out there, absorbs more in the shorter wavelength range. Oxygenated hemoglobin absorbs more in the longer wavelength range. So we can do multispectral imaging, meaning we can image at several different wavelengths, and then do a little bit of math and generate measurements of total hemoglobin and oxygen saturation. Okay, so this is nice. Not only can we do these measurements, I mean, you can do this with a pulse ox, those things you clip on at the hospital, you clip it onto your thumb, you get an SO2 reading. But we're able to do this with very, very high resolution, and again, completely non-invasively. And I want to give an example of this in a second, but I kind of want to give more of a case study here to demonstrate the use of these kind of measurements. This is from a demo we did where the person had an orthotopic breast tumor. You can see things in just the B-mode image here, and that's, by the way, the B-mode movie is sort of stepping through different slices in 3D, so you're looking at getting this 3D view of that tumor. The bright tissue, like here, for example, is fat tissue, and then you see the tumor here, so this is a fat pad of the tumor, and then you see other structures like lymph nodes in there as well. So we get all this anatomical information, in addition to being able to do that in 3D and do 3D volume measurements of not just the tumor, but maybe the lymph node as well. And this is our oxygen saturation image. So you're looking at a blue and red and white color map here. If you look over to the side here, you'll notice that here there's, in the red, it's 100% oxygen saturated blood down through the white into the blue, which is less oxygen saturated blood right down to 0. So now we've got this parametric map, high resolution map of oxygen saturation in vivo. And this can be important, in the following way. This is an experiment that we did where we had the animal, that's that same breast tumor, we had the animal just breathing 100% oxygen. We turned the oxygen down to, say, 5%, put the animal in a state of general hypoxia, and you'll see that oxygen saturation in general drops. And then we put the animal back on 100% oxygen so it recovers, and we have, we restore the animal, restore the oxygen saturation in the blood. And then we drew ROIs in different areas, and you'll notice that, for example, in the yellow ROI here, you'll see the signal drops off dramatically, especially in the red one here up at the top. You'll see the SO2 drops off and then it recovers after we put the animal back on 100% O2. The ROI here in the center of the tumor, you'll notice that the SO2 over time doesn't really change that much. So within that tumor, there could be non-functional vasculature, but for some reason, there's something abnormal going on with the vasculature within the tumor. Again, not surprising, but we kind of found this as a good way to do a sort of an assay, an assessment of which vasculature is functional and which is non-functional. Also, along with this multispectral imaging, we can get measurements of total hemoglobin. The exact same scan, okay? We just flip a little parameter and this is the exact same data, only we're displaying total hemoglobin. And I didn't really expect anything very dramatic here, but if you look at this red ROI, when you put the animal on in the hypoxic state, the total hemoglobin just goes way down. So you've got real-time hemodynamics here, vessels which are constricting, you've got less blood volume for whatever reason going into those areas. And again, in the middle of that tumor, there's not that much going on. So you get these dramatic differences. You're looking at sort of these real-time hemodynamic changes in and around that tumor. So I think the HBT or total hemoglobin data is quite valuable as well. And that's, in a short time, and I've seen people use different drugs for inducing, vasoconstriction or changes in oxygen saturation, which have effects on a slightly longer time scale, but also over the scale of days. You have this advantage of having a non-invasive modality that you can use in a longitudinal way. We can look at the animal at day 0 and then later at day 2 and do these same assessments in 2D and 3D of oxygen saturation, total hemoglobin. What are the changes? And I'll give an example of this a little later as well. I like this example as well. So this is a sub-Q tumor, maybe a little less interesting than an orthotopic, but a sub-Q tumor. We do an injection of the microbubbles, which I talked about earlier. You see them come into the bottom of the tumor down here, and then they sort of perfuse up here. And there's this area, again, using the VivoCQ analysis software, well-perfused area, and then there's this area here which doesn't seem to have any microbubble signal in it whatsoever. Then we've got the oxygen saturation image, and again, not surprisingly, we've got higher SO2 values here than we do in this area here that's not well perfused. We turn on the total hemoglobin, and we see that there's a huge amount of blood in this area here. So maybe this is a hemorrhage within the tumor, a blood pool within the tumor that we're seeing. Physiologically, I don't really completely know the relevance of all of this in this particular model, but what it points out is that you can really get these different complementary but overlapping modalities. So with essentially one instrument, one scan, you can generate a bunch of different types of data which overlap a little bit, but which tell you more than any one modality alone could tell you. So this is an advantage of being able to have things like flow, perfusion, oxygen saturation, total hemoglobin on the same instrument. As far as analysis goes, I want to talk a bit about contrast agents. So everyone's familiar with the fluorescent agents, where initially these were discovered in things like jellyfish, and since then, many, many different kinds of fluorescent agents have been developed. I kind of liken that to the situation with photoacoustics, where we have this endogenous signal, we have this hemoglobin signal that we can see already, but there are many different contrast agents which are being developed, things like old nanorods, carbon nanotubes, liposomes, dyes even, all sorts of different things which can be used as contrast agents for photoacoustics to do molecular imaging applications. So with that in mind, we've got tools on the system to be able to characterize these different agents. So you want to see their absorption spectrum. You want to sort of characterize their absorption spectrum. We were doing this just yesterday with an IR800 based dye. It's a fluorescent agent, but we can also get signal from it with photoacoustics. And you can see, these different, this is wavelength here on the X and then intensity on the Y. So we can generate these, intensity curves or absorption curves spectral profiles, if you will, of these agents, and then go ahead and use them in vivo. And an example of this is a collaboration we had briefly with University of Rochester, where they're looking at osteoarthritis. So they were interested in lymphatic function and how lymphatics are affected by osteoarthritis. And we injected ICG into the synovium of one knee and methylene blue into the synovium of the other knee. These then perfuse into the lymphatics. They go into the iliac lymph nodes, which are right beside the abdominal aorta, right near the bifurcation in the lower abdomen. And then we did this in vivo imaging. So we're looking at a cross-section across the lower abdomen of the animal here. We can see structures, and these are a bit more meaningful when you actually are doing the real-time imaging. These are just still shots. But you can see things like the abdominal aorta. You can find the iliac lymph nodes in this case as well. But then we can use multiple wavelengths on the vivo laser. We can do this multispectral imaging and then unmix different signals. We know, for example, that methylene blue looks different than blood, and ICG looks different than blood, looks different than methylene blue. So we can actually unmix these three components and display them in this image down here, where ICG is obviously in green, methylene blue is in blue, the background blood signal is in red. So we can then unmix these, place them within the anatomy using the ultrasound, and then have this sort of functional data. And I kind of like this image. This is an image that we acquired at a demonstration where they've got a fracture model. So they introduce a small gap where the break was, and they want to see what's going on in that gap as far as the healing of that and so on. So they wanted to image this and see what they could see. So not only could we quite easily find the femur with ultrasound, then we turned photoacoustics on. In this image you're looking at, red is oxygenated hemoglobin, blue is deoxygenated hemoglobin. The plate itself absorbs in the near-infrared range, this metal plate, so we were able to unmix that from the signal as well. And then there was this sort of echogenic tissue, which also gave us a photoacoustic signal, which looked different than blood and the plate as well. I have no idea what it is, but neither did the researchers who were doing this work, so I don't feel so bad about that. But the point is, we're able to unmix these different things and display them all in one image. I'll talk briefly, I'm not sure I'm doing for time here, but I'll talk briefly about some of the applications. For example, this is a nice one because it summarizes, at least in a cancer context, all of the functionality of the system. It was a sunitinib treatment study, so sunitinib is an anti-angiogenic drug. We just had control and sunitinib treated animals, and we went through this study to see what we could see with just tumor volumes, perfusion, and then oxygen saturation. We noticed that the volumes did not change with the sunitinib treated animals versus the non-treated animals where the tumors grew. We noticed that in the perfusion here, we noticed that we were seeing a great reduction in perfusion in the sunitinib treated animals, which makes sense since we're using an anti-angiogenic. And then we saw a corresponding decrease in the oxygen saturation. And you can also see there's actually less blood in this tumor than there is versus pre-treatment as well. So again, just showing this sort of holistic approach that the system has, at least in the context of tumor biology, where we can go from tumor volumes, tumor perfusion, oxygen saturation, and total hemoglobin, and learn more about the physiology and pathology of that disease and the treatment. Now, of course, everyone wants to do targeted molecular imaging, and there are several examples, but I want to focus on one. This was published in Cancer Research quite recently. It's from Stanislav Milyanov's group at UT Austin. And they've been working on this for a while, but they're developing a contrast agent based on gold. So they've got this gold particle, which absorbs very, very nicely in the near-infrared range, so it's good for using with photoacoustics. They have this gold particle, and they can either have a targeted particle or a non-targeted particle. And what they did is they had 3 dishes just of cells. So they were looking at these cancer cells in the dish, and they looked at what does the cancer cell in the dish look like with photoacoustics. And they found that if they looked across the absorption spectrum, they didn't really see much. There was a fairly flat absorption spectrum of just the cells. That's this blue line here. In the second case, they had their particles, and they put their particles in the dish with the cells. The particles were not targeted, okay? So they just floated around in the extracellular space. And they found that they did get this nice absorption curve coming from the nanoparticles, not surprisingly. and that's this green curve here. Finally, they had the third dish, and they put in particles that were targeted. And these particles would be taken up within the cells due to their targeting moiety here. And in this case, the absorption spectrum changes. So now you get this purple line. When the particles are actually taken up by the cells, you get this shift in the absorption spectrum. And because of this, they can now have a nice assay for assessing the presence or absence of this type of cell based on the targeting ligand, of course. So they did this in vivo, of course. They had a model of metastasis. So they had a tongue cancer, which metastasizes to the sentinel lymph node, which happens to be the cervical lymph node in the neck of the mouse. So this image here, here's the mouth of the mouse, you're looking at the ventral surface of the mouse. The tumor cells would break off and they travel down to the sentinel lymph node into the first lymph node here, the cervical lymph node. They could find the lymph node with ultrasound and then take a look at it with photoacoustics. And they did several versions of this experiment. They had a mismatch, so they had particles in there, but they weren't targeted to the cells. Okay, similar to that second dish in the previous slide. They didn't see any signal. No tumor, targeted particles, so that's sort of their negative control. They didn't see any signal. But with their EGFR targeted particles, they were actually able to detect tumor cells within that lymph node before they're even visible on ultrasound. Eventually they'll grow into a tumor, you'll be able to see them. But this is before they're visible with ultrasound. So this is early detection of this metastatic tumor model using these targeted nanoparticles. So this is a kind of really nice example, and again, that puts together a lot of the different capabilities from just doing anatomy and finding these different structures to then being able to say, yes, there are metastases in this structure based on the targeted particles they were using. This is another example. This was done in collaboration with Johns Hopkins, Dr. Lloyd Miller, and they were interested in looking at bacterial infection. And they were particularly concerned with these biofilms that can form over implants. So someone goes into the hospital, they need a hip implant, let's say. The implant gets put in, and if it's contaminated, especially with something like Staph aureus, that can form a biofilm, this biofilm that grows over top of the implant. Very, very difficult to treat. Often what they have to do is take the implant out, wash it, and put it back in. Obviously, there's a lot of problems associated with that. And they just wanted to be able to see, okay, can we image bacterial infection in some way, so we can have some way of being able to see it, to see whether or not the infection is there. So they started out with a bacteria that was bioluminescent, so they were able to see bacterial burden, and that's what you're looking at. On the left side of that image, you're looking at images of bacterial burden. Okay, so different animals, they inoculate those animals with Staph aureus, and the Staph aureus would glow, and they're able to see them. And then they said, okay, let's introduce an agent which is able to tag those bacteria. So they used an antibiotic, which was conjugated with indocyanine green. It's a near-infrared dye. It's used in the clinic. So they attached the antibiotic to ICG, and they injected it into the animal. And then they saw signal here, where they had bacterial burden. They saw signal on an optical imaging modality, obviously, being able to see, okay, yeah, we can see our antibiotic, and it seems to be going to where the bacterial infection is. This is great. Now, because we can see indocyanine green with photoacoustics, what does it look like with photoacoustics? So they invited us down, and we imaged their animals. And this is the kind of thing we saw. So you're looking at, in the top right image, you're looking at a longitudinal section of the hind limb of the animal. So we just put the probe down, we did multispectral imaging, we did some unmixing, and that green signal that you're seeing there is signal that's coming from ICG. It's coming from that ICG conjugated with the antibiotic. And the infection was inoculated intradermally, so they just injected it under the skin, and you can actually see, on the surface, you can actually see these lesions in the skin caused by the infection. And of course, we see a lot of the dye accumulating right there at the site of infection. But unlike the optical modality, we were able to see deeper in the tissue. Now you can see a whole bunch of different places where we see that dye accumulating. Potentially a whole bunch of different places where you've got that infection spreading. And I think it's noteworthy to see it also in this lymph node here. So we're able to just see the lymph node with the ultrasound. And sure enough, you've got a lot of accumulation in the lymph node, which you would expect. And we can do segmentation for different structures like bone and lymph node and skin line and that kind of thing, and be able to put all this signal in the context of the anatomy as well. I just have a couple more examples, and then I'll finish up. Another nice one is reporter gene imaging. So instead of having to introduce some kind of exogenous agent, have it delivered through the circulation, there are challenges associated with that, of course. What about having a cell type express its own endogenous absorber? And in this case, why not use an endogenous absorber which is already expressed in the cells of animals, which is melanin? And they had these animals which were tyrosinase expressing, inducible tyrosinase expressing animals. But tyrosinase is the enzyme which creates melanin, and they were able to basically turn on melanin production in these cells. Now, melanin absorbs in the near infrared range, so we can see it with photoacoustics. So they sent us these animals, and we did some imaging with them. And before the induction, so you just give the animals doxycycline in the drinking water, and they'll start producing melanin. They'll start to get this tyrosinase activity. So pre-induction, we looked at the tumors, and one on either flank. This is in the same animal. And we saw, just differences based on, the hemoglobin that's there. Now, post-induction, this is about a little over a week later, you see this huge signal accumulating in the tyrosinase positive tumor and nothing in the tyrosinase negative tumor. And sure enough, when you cut these tumors open, you see a huge amount of melanin expression in the tyrosinase positive tumor, none in the tyrosinase negative tumor. Confirmed this by histology, and this was published in scientific reports. And Roger did some of his own spectral unmixing to unmix these signals and to be able to actually quantify the extent to which melanin was expressed as well. So again, this is, if we want to see, expression of a gene of interest, you put, your promoter for your gene of interest in front of the tyrosinase gene and just have tyrosinase expressed wherever your gene is being expressed, and being able to visualize it non-invasively at depth with high resolution. Very powerful tool. Kind of, I think, to Roger's chagrin, this was published a few months prior in scientific reports as well by a group at Stanford. And the reason I'm putting this up is that they did a nice job as well. They did the same thing. I don't think it was inducible, but they had melanin production in tumors. And they used multiple modalities to be able to see it. They used MRI and PET and photoacoustics. And I like this because it sort of illustrates, this is the MRI image, this is a cross-section across the whole animal, and here's the tumor indicated by the arrows here. In PET, same thing, you get a sort of longitudinal section, and then they've got these arrows pointing to the tumor. In PA, this is the whole tumor itself. So again, this high resolution allows you to say, not just is something being expressed there, but how much and in which parts of the tumor, in which parts of that microenvironment is it being expressed. I think I'm going to finish off with this, but this is a Neuro Imaging. This is something that's come up relatively recently. It's fairly exciting. With just regular ultrasound imaging, it's somewhat difficult to see structures within the brain, even of a mouse. The reason is the skull will reflect a lot of the ultrasound. It's very difficult to see anything beneath that. Photoacoustics comes in, and instead of the situation with ultrasound where you need the sound to go in, then bounce off, and come back out through the skull, with photoacoustics, we just need to get light in, and the sound only has to go one way. It only has to get out to make our image. So we imaged some animals, and we found, wow, the level of detail that we were able to see was much, much higher than we were able to see in ultrasound. And again, we're looking at vasculature within the brain. So there's I'm going to skip past this, but there's a lot of different applications which this could benefit here. In this case, brain imaging potentially. And again, this is a group at the Koch Institute at MIT who had brain tumors, and they asked us to take a look at them. This is a contrast imaging that we were doing, and we put contrast in. And again, you can't see that much in the B mode, but as soon as you go into the contrast mode, you see the microbubbles come into the circulation, and you can see right away there's this asymmetry between the left and the right hemisphere. And they had told us that they injected these tumors in here, and the tumors get quite large. So we're seeing different perfusion patterns, not just within the brain, but within the tumor itself. We're able to quantify that with the VisualCQ software, but we also turned on Doppler to see, okay, with blood flow, what do we see with the blood flow in the brain? Oh, yeah, sure enough, it's changing from the left to the right side. And then oxygen saturation as well. We saw differences in oxygen saturation. So I think, again, with this neuro imaging, being able to look at perfusion and oxygenation and blood flow, we can start to say things, at least about the vasculature within the brain, Something again that ultrasound typically hasn't been so strong at. So I think there's a lot of potentials for different applications here. Another obvious one is doing stroke imaging. We're already doing a lot of cardiovascular imaging. A lot of our customers are rather. So what about doing imaging a stroke? And one of our sales managers brought in a customer by the name of Alex Kwan from Emory University, and he's got this stroke model. Instead of what many people do, which is basically stick a wire up through the carotid and poke around and try and block the middle cerebral artery, which feeds a large portion of the cortex. He had this way of doing it where you just occlude the common carotid artery and then put the animal on a hypoxic gas of 7.5% oxygen for 30 minutes. When you return the animal to normoxia, the theory is that there's all these microthrombi that can form when you've got this insult, this hypoxia ischemia they call it, and these microthrombi form, and it's they think it's a more accurate simulation of what's going on in the clinic, where people can undergo surgery, and when they're recovering from the surgery, they can have stroke because they've had this hypoxia and ischemia. So they've developed this model of ischemia, and they came in and we did the surgery, and we saw obviously differences when you occlude the common carotid artery. Not surprisingly, you see the right common carotid, you see changes in the flow in the right side of the brain, you see changes in oxygen saturation in the right side of the brain. And then we turned the oxygen down, and sure enough, you see decreases right across the whole brain because there's less oxygen getting in there. But then when we recovered the animal, so we released the occlusion, it's a releasable knot that they tie around the common carotid. You release the occlusion, you put the animal back on room air, and you see this recovery in the left side, but you don't see the full recovery in the right side. And this sort of correlates nicely with some of the data that they have, where they show these infarcts on the right side of the brain after doing this sort of challenge. And we saw sort of corresponding data where we don't see a full recovery of the oxygen saturation in that side of the brain, sort of corroborating what they've previously done. I lied. I'm going to finish off with this, but it's just one more minute. There are always, VisualSonics is owned by Sonocyte, which is a clinical ultrasound company, who is in turn owned by Fujifilm, which is doing a lot of medical imaging kind of things. So there's always an interest in doing clinical things. What can we see with photoacoustics? It's a brand new imaging modality. What can we see with photoacoustics clinically? So just scanning the hand, you can see right away. We can see things like vascular structure in the superficial vasculature. Doing something like this, again, just really proof of concept stuff, but what about something like digital ischemia, which is a real pathology? What about simulating it by just tying a piece of string around the finger? And we can see differences. This is an image where a piece of string was tied. I don't know if anyone did this as a kid, but you watch your finger turn blue, right? So, so we did this, and then imaged across here, a cross section across these two fingers with the non-ischemic and the ischemic finger being able to do these oxygen saturation measurements. So I think, again, some of the unmixing comes into it as well. There's applications such as wound healing, peripheral arterial disease, and these kind of things that we're exploring. But I think that there is potential, at least, to do some of this clinical research and see how this technology can be brought into the clinic in a certain way. Anyway, that's the end of my talk. Again, thanks for having me, and if anyone has any questions, I'd be happy to take them now. Are there any questions? So I don't know about the schedule for the rest of the day, but
yeah. So